A campaign group says people with learning disabilities are being locked up instead of receiving care in the community. Dawn Kavanagh set up the group Stolen Lives after the traumatic experiences of trying to find care for her son. She says too often he was inappropriately placed, including in hospitals. The group is calling on the Welsh NHS to publish data on how many people with learning difficulties are being held in hospitals or secure units. Nellie Bird has the details.
On the steps of the Senedd, campaigners gathered, people with disabilities and their families wanting to make their voices heard. Like Dawn Kavanagh, whose 21-year-old son Jack has a learning disability, autism, epilepsy and ADHD. For the last few years, he's been in a hospital, miles from his home.
It's devastating. It's one of the most traumatic things a family can go through. And the families that I speak with, I've got some families who have to travel into England to see their loved ones. They're only given a limited amount of time. And for someone with a learning disability, they really struggle to understand that.
Dawn organised this event and set up a campaign group called Stolen Lives to push for change. The group say they want homes, not hospitals, appropriate support for their loved ones with learning disabilities, who they say don't need medicalised care. It's something that Sophie Hinksman feels strongly about. She has fetal alcohol syndrome, which affects her brain and how she processes information. She lives independently, but a few years ago found herself in hospital and then a secure unit after she became severely depressed and had a breakdown.
It was horrible. There was a lot of people that was noisy and shouting for help and stuff, and all I wanted was a bit of peace and quiet.
Sophie believes she wouldn't have needed to be placed in hospital if there'd been a better understanding of her disability.
To be placed in a mental health secure unit because they've got nowhere else to, they haven't got the right support to support you at home, then I don't think that's acceptable, really.
Exactly how many people with learning disabilities are staying in hospitals is not routinely published, but the Welsh Government has told us that there are currently around 140 Welsh patients in specialised inpatient services in Wales and England. But the group want more transparency on the figures, and it's being backed by charities.
There are people still very much in long-term placements in hospitals, in units, in mental health units or assessment units, and we don't know the numbers. We know that they're significant.
The Welsh Government said it took the care of vulnerable people very seriously and that it was committed to reducing the number of people with learning disabilities in hospital, but it denied that anyone was being held inappropriately. More than 150 people gathered at the event today, many families affected, desperate for change.
Well, Wayne Crocker is the director of the Charity for People with Learning Disabilities, Mencap Cymru, and he joins me now. Good evening.
Good evening.
A lot of these claims almost belong to another era, don't they? I mean, I thought a lot of the old institutions had closed.
That's right. I remember, 30 years ago, there was a big movement to move people out to the long-stay institutions. I remember opening a campaign on the Eisteddfod field in Llangefni in 1999 with two residents of Bryn and Nyedd to start that movement. And we were successful in getting those large institutions like Hensel and Ely, Bryn and Nyedd, Llanbreffer Grange closed. But what's crept in since those big institutions closed is these mini institutions people are being put into them.
So the Welsh Government says it does not agree that people are being systematically detained inappropriately. How often and how is this happening, do you think?
The data is very poor. The last set of data that we were able to see was produced in 2019. That said that just over 250 people with a learning disability or autism were in institutions either in Wales or in England, and that was costing over £40 million. Of those, just short of 100 were in a mental health unit within some sort of institution.
And inevitably, when we talk about things like social care in the NHS, we talk about funding. Is it a money issue?
I think it's a mix. I think there needs to be a new strategy. I think the Welsh Government needs to start leading from the front and not allowing the local authorities and local health boards to design what services they think people need. They need to listen to parent carers. You've seen in the piece today, lots of parent carers are very frightened for their sons and daughters. So we need to have leadership from the very top within Welsh Government.
And we got a sense from Nellie's piece there of the impact on families. How does it affect people?
So I work with a lot of families. I'm 30 years now in MenCap and working for another learning disability organisation before I came to MenCap. And I've worked along families who are really frightened that if their sons or daughters have episodes, if they become unwell, what will happen is they will be put into institutions, they will be sectioned, and they won't see them again.
OK, Wayne, thank you very much indeed. Wayne Crocker, Director of MenCap Cymru.